Okay, so we are looking at blood changes or hematological changes in someone that has what? Rheumatoid arthritis, as basically a prototype for other connective tissue disorders. You understand? So you know that the patient has some problems with their connective tissues. So what will be the blood changes in a patient that has what? Problems with their connective tissue. So for this one, we're moving like this. For the blood changes, we start with the red blood cells. So in red blood cells, normally they are count to decline or decrease. That's what is known as what? Anemia of chronic disorder. All right, anemia of chronic disorder. It may be complicated by iron deficiency anemia from gastrointestinal tract bleeding, which is related to maybe they are now like side effects of some drugs that are used in treating rheumatoid arthritis, like salicylate, non-steroidal anti-inflammatory drugs, corticosteroids. You understand? All right. So it's side effects of those drugs. You understand? Then bleeding into inflamed joints. So you know in rheumatoid arthritis that your joints are becoming inflamed, right? So there's bleeding into these joints. All right. Then autoimmune hemolytic anemia, right? Then red cell aplasia will always be seen if there is what? Systemic lupus and erythematosus. Okay. So what we are moving here is this. Therefore, the white cell changes. Okay. There will be neutrophilia, indicating that there's inflammation. All right. Then immune-mediated neutrophil destruction, eosinophilia, will be seen in systemic lupus erythematosus, rheumatoid arthritis, polyarthritis what? Polyarthritis what? Nodosa. Then leukopenia with reduced neutrophil and lymphocyte counts, often associated with circulating immune complexes. You get. Therefore, platelets and coagulation abnormalities. There will be autoimmune thrombocytopenia. All right. Then thrombocytosis commonly be seen. Antiphospholipids antibodies usually be seen in systemic what? Lupus erythematosus. Right. Then in antiphospholipid syndrome, they're circulating what? Anticardiolipins. They interfere with blood coagulation. Okay. And predispose the patient to developing arterial or venous thrombosis. All right. Then if it's a pregnant woman, you see what? Recurrent abortions. Okay. So I think that was it for the blood changes, right, in all these other connective tissue disorders that we have, and especially looking at rheumatoid arthritis.